Saving Teeth awareness campaign is about making sure that everyone at risk of losing a tooth understands their choices, and that treating and keeping the natural teeth should always be our first choice.
It's about the public, it's about our patients understanding that if there is a possibility that they could lose a tooth, or they've been told that they may have to lose a tooth, that they need to know there is a solution possibly for them, and that solution would be root canal treatment.
I'd had root canal before, and I don't remember it being that terrible, but it's people's reactions when you say you're having root canal. I think everyone, they're just such awful words to hear for most people. You associate it with pain and discomfort. So I was quite nervous, but it was all fine. I wasn't aware that you could see a specialist dentist to have root canal.
There's some very clear medical reasons why teeth should be preserved and shouldn't be extracted. Endodontists who do root treatments, all they do all day long is root canal treatments, often fairly complex cases. So they're used to doing them, they've got the experience, they've got the expertise, they've got the equipment, and they can get some really very good results.
Often dental infections can remain undetected in your mouth. However, there are telltale signs that there may be something harbouring beneath your tooth that needs attention. These are the things you need to make your dentist aware of. And if he cannot come to a diagnosis for you, there certainly are specialists out there who can do that diagnosis.
And that's what we are. We're experts in saving teeth. We have extra years training, and we have many years of experience of just carrying out root treatments.
I remember my parents, you know, at night they had the glass by their bed, and they're false teeth in them. And I don't want that. I don't want that for my children. And I know friends that have got, that have lost teeth where probably if they'd gone to see the right person, that tooth would have been saved. And I think it's important. Your teeth are an important part of your whole sort of persona. And, you know, why not hang on to them if you can?
Never be afraid to ask, and what are the benefits of having this tooth root treated as opposed to having it out.
I always liken saving a tooth pretty much like building a house. If you've got a sound, healthy foundation, which the endodontist will give you, your dentist can build whatever he wants on top of that and will save your tooth.
There are situations where some teeth simply can't be saved and do have to be removed. Root canal treatment, saving a tooth with root canal treatment, followed by a restoration, that's a crown, being placed on the tooth afterwards, is certainly an economical way to preserve a tooth in function.
The greatest asset an endodontist has in his armamentarium is a surgical operating microscope. It's quite simple. If you can't see it, you can't treat it.
The real message then of this campaign is that I want patients to know that their teeth can be saved. There's no reason why, in this day and age, they have to lose that tooth.
So over to you. How much does having a healthy mouth matter to you? Ask questions of your dentist and see what they can do for you. It may surprise you, but medical evidence tells us that people with healthy mouths live longer, which is why, where possible, keeping our own teeth and keeping them healthy should be the priority.